All right. Hi, everybody. Thanks for spending your lunch break with me. I appreciate it. I know this is time to catch up a little bit, check your email and all that, so I appreciate you spending a few minutes with me. I'm James Michelini. I'm the CEO of Surgeon Design Center. We're an orthopedic product development firm based here in Portland, Oregon. So today I'm going to talk to you about the surgeon inventor's journey, and we'll talk a little bit about how the roadmap for orthopedic innovation has changed, putting innovators, inventors, entrepreneurs in the driver's seat, and how we can partner with you to improve the standard of care for your patients. All right, any Family Feud fans in the audience? We surveyed 100 orthopedic surgeons and asked them, what do you do when you have an idea for a new product? I'm not actually going to let you yell things out because I've watched enough Family Feud. Somebody will say something inappropriate that I wasn't expecting. So we'll go through some of the most common responses that we get to this question. So you can make a prototype, right? It's a great place to start. It's fun. Find an engineer with a 3D printer, hop them up on Mountain Dew, sketch some things out, make some prototypes, put your hands on it, right? And start to get a feel for it if there's something there. And then now what? What do you do with that? You could get a patent. Patent attorneys are brilliant. They're often PhDs with multiple patents of their own. And if you describe an idea well to a patent attorney, they'll almost certainly get you a patent on something, right? But what they don't have is the perspective to know what is clinically relevant and what's commercially viable. And if you secure your patent too early in the product development process, you run the risk of likely rendering that IP obsolete once you actually continue to develop and refine the design, and you'll end up starting the whole process over again. You could call your sales rep. Sales reps are great advocates to connect you to device companies, but ultimately, you'll almost certainly get a non-answer or a soft no thank you. When I was at a large orthopedic device company, we had a great team and internal process to review surgeon idea submissions, but ultimately, it was not much more than a no thank you committee. We often reported over a 99% rejection rate of surgeon idea submissions. And it's no different at all the other orthopedic device companies. Supporting surgeon ideas is just not part of their R&D pipeline. So before we look at the most common answer, we'll just take a step back for a second and just talk about the whole product development lifecycle. So first, foremost is a clinical need. I like to really start there and not actually start with that idea and the light bulb moment, because the most important step of the process is identifying a meaningful, unmet clinical need that we need to solve. And that's actually my favorite place to start conversations with surgeon inventors. I think a lot of people assume you have to have had that eureka moment your own and solved the problem, right, before you talk to anyone or do anything. But that's where we can help, right? And that's where good engineers and product development folks can help figure out how to solve the problem. But identifying the problem to solve is something only you can do. So from there, you actually get into concepts, start sketching, start brainstorming, right? And when I started in orthopedics about 20 years ago, this was often all you needed. You could go to a device company with not much more than a napkin sketch or a drawing on a chuck, and they would assign an internal team. They would take the risk, they would spend the money to see if there was something there. Often, partnering with you with a consulting agreement, potentially royalty, speaking opportunities, right? They assigned a lot of risk and resources to those ideas. But today you need to keep going. Again, today you get a no thank you. So you get further in the design, you're really ambitious, you start making more prototypes, doing cadaver labs, testing things, iterating on that. Then you go back to the patent attorney, now's a better time, you get your IP in place. Surely this is enough, right? I'm gonna highlight briefly one of our current clients in a project we're working on. So Dr. Ray Thal is a pioneer in arthroscopic surgery. He's the inventor of the world's first knotless suture anchor. He's the primary inventor. He sold that to MyTech almost 25 years ago. He holds 18 patents just in arthroscopic technologies. But about a year ago, when he went back to one of those device companies that he's done multiple products with in the past, with his latest technology, good prototypes, IP in place, he was told, Ray, we'd love to buy your company, but we just don't buy ideas anymore. Right? So if he can't do it, you can. So you go through the rest of the process, right? And You need a manufacturer. You need to figure out not just can you make a prototype, but how can you actually make this at scale, make it out of the right materials, have the right margins, processes for what you need to have a commercial product. You have to figure out your regulatory clearance, work with a regulatory specialist, determine your path, do all the appropriate testing, verification, validation. Go through the VAC process, right, which needs more than just a product. You need your surgical technique and your labels, and you need a sales team to actually support it. You need good reps and distributors to actually spend the time supporting the approval process, supporting the ongoing sales. And then if you've done all of that plus a bit of luck, you start to see clinical adoption. And today that is the milestone where device companies are engaging with these types of ventures. I was on a call recently with Viren Mehta, who runs the Johnson & Johnson Venture Fund, talking about when strategics are interested and what they look for in acquiring. And he spoke at length about unless you have a truly disruptive, a breakthrough technology where they want to control integration into their ecosystem or maybe guide a pivotal study towards the data that they would be looking for, that they just don't invest or acquire in technologies until you've really mitigated all of the risk. And we talk about risk in multiple categories. So the first is what we often think of, which is the technical risk. Can you actually do what you say you're going to do? Is it scalable? Does it have the right manufacturing and the margins? Does it meet their quality requirements for integration? Second is clinical risk. Does this actually help patients in a measurable and meaningful way? And then the third, and where the threshold is really moved, is that commercial risk. Is they are looking for things with no commercial risk. They want to see reimbursement. They want to see broad adoption. Okay, so if you have to do all of this yourself, and somewhere along the way, you started a company, raised a round or two, put a board in place, done all the legal work, right? How are you expected to get any of that done in all the spare time that you all have, right? And so that's why the overwhelming response to what do you do when you have an idea is nothing, right? And I have far too many surgeons I've talked to with a sketch, a PowerPoint, a prototype, even patents. You see, I've got this, when they connect with us, I want to talk about this thing. And then you look at the dates and these things are 5, 7, 10 years old because they made those first steps, some even as far as patents, but then just there's nowhere to go from there anymore. So that's where we come in. We started Surgeon Design Center to bridge that gap between clinicians, who are really the only ones who can identify the most meaningful problems to solve to help their patients, and the device companies who've shifted their business model away from internal resources, away from front-loading internal risk, and towards just growth through acquisition. We've got an incredible team here who have dedicated their careers all to orthopedics. We've got over 120 years in the industry and over 40 patents granted. And throughout those careers, we've led the design on over 60 innovative products across trauma, extremity, sports, and spine. And we only do orthopedics. We're not, there's some companies will say we develop medical devices. There's just no way you could be an expert in everything that falls under the umbrella of a medical device. So we live and breathe only in orthopedics. So if this were an infomercial, which maybe feels a little too much like, this is where I'd reveal the magic, right, the secret. There's no shortcuts, there's no magic tricks, and honestly, this is not for the faint of heart. The bar really has moved. The reality is the burden of innovation has shifted from device companies onto individuals and startups. But I feel like so has the opportunity to control how we innovate and to reap the rewards of taking that risk. The upside for those of us that do go down this path is if we take all of the risk, there's a much higher reward at the end of that, for making this progress on your own. So, with our experience, our relationships with device companies, we understand what it takes to successfully bring a product to market. I'd love to have another few hours to really get into the weeds on exactly how, but for now we'll say that we've developed our process to really take a holistic, risk-based approach right from the start. Because as much fun as it is to really just jump right into making things and breaking things, far too often you can go far down that rabbit hole and then you just hit a dead end because you didn't have visibility on the whole process and really what your end point was towards either an acquisition or a sustainable commercialization. So we front load that risk reduction and value creation to ensure the highest likelihood of success. And as we pass each gate along the way, we continue to refine our goals and reassess what are our major risks, what are our major unknowns, what questions would an investor or an acquirer ask, and that's where we focus our energy to make sure that there's never sunk costs and that we're always moving towards an attainable target. Along the way, we work directly with top device companies, universities, manufacturers, and accelerators in orthopedics to make sure we have the right relationships and the right perspective to guide you in the right direction. We have with us today at our booth, if you haven't already stopped by our table, we've got a great case study of this in motion. So this project started with a very humble problem statement of that provisional fracture reduction is often the most clinically important and most technically challenging aspect of the case. And starting just with that problem to solve, in under 2 years, we've gone from there to creating a new device company, Axia Orthopedics, and the Aero system is slated to launch very soon, Q1 2026. Along the way, we've secured a comprehensive IP portfolio, raised $2 million, put together a board, a surgeon team, and a sales team to ensure that this is going to be a successful launch. If you're interested, we've got the demo and everything out at our booth there, and we are actively recruiting. Did this go off? Did I just get hooked? They cut me off? You probably still hear me okay. That's okay. I was just saying, Andy here is the CEO of Axia, and we are looking for surgeons who are interested in this, to start the VAC process locally. Oregon will be one of the first regions to have this available. So that's it. If I haven't scared you away already, if you have a problem you want to solve, you have an idea at any stage, we'd just love to continue the conversation. We always start with just a, no obligation, whatever, just confidential, scratch the itch and triage a little bit, see if there are any red flags, any easy questions we can answer. The mic just cut out. So we have a little bit of time. I have some common questions, but I also want to just open it. Oh, it's back. It's back, just in time. Perfect. So I touched on a lot there. I know I went very fast, and I really appreciate your time. Does anybody have any questions, thoughts? Stunned silence.
How do you guys work financially?
Say that again?
How do you work financially, right? So
Great question.
You got 1,000 concepts, but how do you gotta decide what to take on and what not to take on?
How do we decide? Yeah, that's a great question. Yeah, I mean, one of the most common questions, well, what's this going to cost and who's going to pay for it? How are we going to pay for it? I debated kind of putting this in more detail in there. I mean, the answer you'd expect is obviously it depends quite a bit on what's the opportunity. But the short answer is, the earliest phases, we're able to make those feasible to be either self-funded, sometimes institutional grants, things like that, right? So we can start very lean and very fast and just scratch that itch and say, is there really something here? We can quickly look at, of course, we can vet the clinical need, we can design feasibility. Is there IP? Is there freedom to operate? What's the regulatory path? We can do all of that very lean. And so those are usually sustainable. And the nice thing about it being self-funded is there's no early dilution for you, right, when we're still creating a lot of value. As we get a little further into design, often our clients still self-fund at that phase, but we can contribute either in-kind services or investment. We can support you through larger funding opportunities, whether that's back through, a lot of larger universities have kind of little accelerator and grant programs or even SBIR grants. And then as we get a little further along, most of these things likely do bring in outside investment, right? Whether it's friends and family for a pre-seed or maybe an angel group. But by then, what we found, like with Axia, I mean, we turned money away easily at that round, even in the current environment when it's hard to raise. Because by the time we're going and asking for that money, we've created enough value, and we've, again, always just focused on what are those risks? Why would anyone say no? That we found that, I don't want to trivialize raising money, but we found that we're able to create enough value that then when you do need that outside raise, you still retain enough of that equity because we've done that upfront work. So I don't know if that's a useful answer. I'm happy to get into specific numbers, but obviously it just depends so much on the scope and the stage of the project. Nothing? Any other questions, thoughts? No?
just one more, I guess I'll touch on another one or two, and then I know we've got to go back to the other talks. So, in terms of the leadership, how do we structure these things? If you want to be the CEO, great, right? But that's probably a lot on top of your day job. I think, again, in the early phases, what we try to do is even though we are looking at so much beyond engineering, we can treat it like a product development project for us, where we can provide the project management and the operational support. So you really don't need C-suite roles on day one, right? Again, the milestone for that is probably pretty similar to the fundraising one, where when we know this is real, we know it's solved, we know there's a clear path to commercialization, we're talking about raising money, then that's probably a good time to put together a leadership team. And that can include the surgeon inventor. It really can be the full spectrum. If you want to be the CEO, great. If you want to step back and be more of a medical advisor, we can bring in fractional leadership as well. It's, again, really just depends on what the project needs. And what the long-term goals are. With Axia, that was one where we clearly said, hey, this is long-term, this is probably well-suited to an acquisition, but in medium term, it will be sustainable as a company that we will actually actively support and grow for a few years. So that needs a little more leadership than if it's something that was really targeted to that early transition, where you're really just getting kind of clinical evidence, but staying very lean and minimal on the company itself. All right, well, I really appreciate everyone's time. Everyone looks locked in, but no questions. So I'll let you have a few minutes to check your emails and all that. We'll be around for the rest of the show. I'll put the QR back up here if you'd like. Nope, I'm going the wrong way. This just brings you to a form to kind of share your email or phone number if you'd like to talk more, or obviously we can just chat in person. So thank you for your time. Appreciate it.